Honey Bears is a multivitamin and iron product that is used to treat or prevent vitamin deficiency. It is especially helpful for those with poor diet, certain illnesses, or during pregnancy. Vitamins and iron are important for the body and help maintain good health. It is recommended to take the daily dosage as directed on the package, usually with a meal to help with absorption. Taking it at the same time each day can help you remember to take it consistently. Make sure to chew the Honey Bear medication thoroughly before swallowing, usually once daily or as directed by your doctor. It's best to take it on an empty stomach, about 1 hour before or 2 hours after meals. If you experience stomach upset, you can take it with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication, as they can decrease its effectiveness. It's important to take this medication regularly at the same time each day to get the most benefit from it. If you experience constipation, diarrhea, or an upset stomach while taking Honey Bears, don't worry, these effects are usually temporary and may go away as your body gets used to the medication. If they persist or worsen, consult your doctor or pharmacist. Iron in Honey Bears may turn your stools black, but this is not harmful. Remember, your doctor has prescribed this medication because the benefits outweigh the risks. Most people using this medication do not experience serious side effects. While allergic reactions to Honey Bears are rare, seek medical help immediately if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6. It's important to keep Honey Bears out of reach of children at all times. If an overdose does occur, seek medical help immediately or contact a poison control center. Before taking Honey Bears, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have iron overload disorder, alcohol use, liver problems, or stomach/intestinal problems. If the multivitamin also contains folic acid, let your doctor know if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia. Untreated vitamin B12 deficiency may result in serious nerve problems, so it's important to consult your doctor for details. Honey Bears may contain aspartame, so if you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this drug safely. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using Honey Bears. Remember to always check for potential interactions with other medications you may be taking. Some products that may interact with Honey Bears include chloramphenicol and methyldopa. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This product can also decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of Honey Bears. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Always consult your doctor or pharmacist for help finding a dosing schedule that will work with all your medications. If someone has taken too much Honey Bears and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, residents can call 1-800-222-1222, while Canada residents can call their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Always be cautious with the dosage of Honey Bears and seek medical help if necessary. Remember to keep all of your medical and lab appointments. It's important to note that honey bears are not a replacement for a balanced diet. It's always best to get your vitamins and minerals from the foods you eat. Make sure to maintain a well-balanced diet and follow any dietary guidelines recommended by your doctor. If you are taking honey bears on a prescribed schedule and accidentally miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. When storing honey bears, be sure to keep them at room temperature away from light and moisture, and avoid storing them in the bathroom. It is important to keep all medications away from children and pets. When it comes to discarding honey bears, do not flush them down the toilet or pour them into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you are unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.